Going to learn about myocardial infarction. So this is actually, and again you get a pain. So pain is because of ischemia, and this ischemia is irreversible. So when there is an MI, so left ventricle will fail, will not be able to pump all the blood that is coming from the right ventricle. So some amount of blood will be pooled. There will be a back pressure and pooled in the lungs. So that is causing pulmonary edema. So there will be dyspnea. So there will be sympathomimetic activity and the heart rate will increase. Because of vasoconstriction, the blood pressure will increase. And the JVP will be elevated because the back pressure reaching up to the like this to the right ventricle and to the right atrium. So JVP will be elevated. You may get a Kussmaul sign positive. That means usually JVP falls on inspiration. Here it may not occur like that. It means it will be rising. When you look at the heart sound, because of the tachycardia, sympathomimetic activity, S1 will be loud. And S2 you can hear A2, P2, so aortic area, pulmonary area, and there is something called Erb's point, third left intercostal space. So in S2 you can get a split. In an LVF it is narrow, RVF the split is wide. So Ramu come with pain, retrosternal chest pain, and Ramu was sweating, was having nausea and vomiting. Okay, all these features, and he was saying the pain was radiating to his arm, left arm, or up to jaw or up to umbilicus. So he reached hospital. He met his doctor. So doctor evaluated his cardiac biomarkers and found that it was elevated, doubled. So normally it's 0.03. Here it is doubled. And also here looked for the ECG. So we told that we will meticulously look for changes in ST. But MI can be of two types, STEMI and NSTEMI, ST elevation MI and non-ST elevation MI. So here definitely you get ST elevation. You have to look for ST elevation in which leads V1 to V4. And here you look for T wave inversion. So what will be the management? How the doctor will manage? So this doctor will manage it by giving nitroglycerin, aspirin, oxygen, morphine, abciximab, beta blockers, and enoxaparin. So for pulmonary edema, furosemide IV can be given, Lasix, and also morphine. Morphine can have an action on pulmonary edema by shifting the blood from pulmonary circulation. So that is one action, not only to sedate, but this action and also bradycardia. So After this, what we do is we will move that patient to cath lab and do a percutaneous coronary intervention. We do angiography. So after angiography, it's an imaging. So we see the blood vessels and also we come to see some areas where there is occlusion. So what we do, we put a balloon angioplasty, a balloon and a stent. Balloon angioplasty will be done, and the time for this from the patient has come. This should be from the patient reaching to hospital to this balloon angioplasty. The maximum time is 90 minutes. Beyond that, we might lose hope. Suppose if this is not available, you can go for fibrinolytic drugs like streptokinase, altiplase, retiplase, tenecteplase. So door to this, we have told door to balloon time is 90 minutes. And after that, we are giving fibrinolytic drugs. And if coronary angiography and balloon angioplasty, if this is not, we have two options, either this one or this one. The main agenda is just the occlusion should be gone. We have to make it like this. So either you can use a balloon or you can do a drug. Okay, even after doing this, if ST elevation persists, what happens? You have to do a rescue percutaneous coronary intervention. So the only important thing, if it is an NSTEMI, first of all you give this ABE mod, and if it fails, you will do a percutaneous coronary intervention, which is called delayed PCI. So you get an idea. MI is a reversible. What are the clinical features? What about auscultation findings? And you should know the troponin will be almost doubled. And what about ST elevation, non-ST elevation MI? What are the changes? V1 to V4 you are looking. In NSTEMI, T-wave inversion. How can you manage ABE mod, PCI, balloon angioplasty, fibrinolytics? This is the management.